What's really fun, now that I've been in practice for 10 years, is that these relationships with people, if you actually like people, you get to have little glimpses into their lives going from room to room. At the end of the day, you feel very, very satisfied because of the number of people whose lives you've positively impacted. Chiropractic and upper cervical chiropractic is very unique in that way that you get that immediate feedback from people about how well they're doing and how wonderful their life is because of something that you've helped them achieve.
I had always lower back pain and it was going down my leg. It felt really weird, especially when I was sleeping. It would wake me up at night. And that was the main reason that I came to Dr. Scholten. It wasn't painful, but it was always present, like a stone in your shoe, like you feel it, but you always want to do something about it. I've been playing soccer ever since I started coming to Jeff and feel great.
When people come and work here as chiropractors and train here, they spend a lot of time trying to understand other treatments. When I started my practice, I realized that I wasn't going to be able to help everybody with everything. And so I went out and I tried to meet other practitioners to understand what they did so that I would understand what my patients were doing in terms of their other treatments, as well as to understand and be able to recognize when a different treatment might be able to help our patients. I don't believe health is an end place. I think there's a puzzle, and we need to keep putting the pieces of the puzzle in place. And so if you can have a practitioner that understands what other practitioners are doing so that they can integrate their care with those other practitioners, I think you're in a really good place.
I had severe headaches. My headaches were caused by muscle spasms, and then the symptoms could be at some points very severe, from vomiting, diarrhea, chills. Yeah, they were very debilitating. I saw Dr. Scholten about 3.5 years ago. I do get headaches, but not the severity that I used to. Probably 60 to 80% better. And again, it's muscle tension. So I know when I need to come back for an adjustment, when I can feel the tension rising.
We look at your posture very precisely and see if you can find neutral relative to gravity. Now, if we're not balanced and that place that we're finding is consistently incorrect, what we would do is we would take you through an exam to understand what's going on with you, and then we would schedule very specific x-rays of your head and neck, a complete case history, a physical exam, and an adjustment. When you get the adjustment, it kind of feels like you're having your pulse taken. It's a very underwhelming experience. If you've ever played golf, tennis, or baseball, you know the better you hit that ball, the less you feel. And so if we're doing our job properly, you really don't know that anything's happening to you. And yet then you get to stand up and you'll look and you'll see that you're much more balanced. After the adjustment, you'll rest for a little while and let the adjustment settle in, because your body has to adapt to what we're doing. It's not just about making the change, it's about making a change that's sustainable for you, that you can keep for the rest of your life with as little intervention as possible. And we would see in those first 3 appointments, are we able to really make a difference that is meaningful to you? That's the very beginning of care in our office.